hundreds of our members showed up, and we had a 96% yes to strike vote. It is just amazing, as you can tell from the cheers of everybody as you were sitting here waiting. We are thrilled by the turnout, and our members have spoken loud and clear to Catholic Health that we want changes.
What are you looking to get as a result of this strike? What changes are you guys really focused on getting for everyone?
Well, we have a few things. One of the things is they need to stop violating the National Labor Relations Act. We want them to set up committees that will work cooperatively with the union and our members to solve problems within the hospital. We want a commitment to safe staffing ratios of some type so that we can make sure that the people in this hospital have the help that they need to do the job. And what we also want, of course I forgot what I was saying. Oh, to make improvements at Mercy Hospital that will make highest quality patient care a reality so that every single person here can deliver the highest quality care that every patient that comes to that hospital deserves. Mercy Hospital is an icon in the community, and these folks want to serve that community well.
And would part of that be, I believe they were just from the planning board for a new operating room?
Yes, and you need staff to run the new operating room. You need staff to run the new beds that they're going to be going into.
So would that be at least a step in the right direction on their end for you guys? A higher quality of care is something you're searching for?
Oh, absolutely. We need the tools to do the job the best that we can.
Now, what are some of the other things on top of that you and your group feel that you need to be able to come to the table and have a successful negotiation?
Well, one of the things we really need is a package, a total package that will help us recruit and retain that staff. It's one thing to say, oh yeah, we're going to do that, we're going to make a plan, but if you don't have a package, an all-together package that helps them stay at Mercy and not go to the competitors, we're not going to be able to keep the folks that we get in the door.
Is that something you guys are seeing a lot of? People come in to Mercy, get a start, and then move on to another hospital?
For the first time in many, many years, they have had an over 11% turnover rate for the registered nurses, and that has not happened before.
So what's next for you guys? You voted to strike. Now what do you do?
Now we go back to the table and we bargain. We were meeting Thursday morning. We're going to continue meeting for the rest of the month of July. We have set some dates for August. We are going to work hard to get a fair contract for all of our members.
And is this going to affect the quality of care that patients get right now at Mercy Hospital?
No, absolutely not.
No.
They are going to get quality care to the best of these folks' ability every single day.
What else should we know? Would you guys have plans to picket? When is that going to start?
There may be a picket in the future. Very likely in front of Mercy Hospital sometime in the next few weeks.
So you said you're going to have another meeting, bargaining meeting on Thursday?
Yes, Thursday this week we will be bargaining again.
And how have you been bargaining to this point? How has that gone so far? Obviously, maybe not super well since we're here tonight, but how have at least the conversations been? Has it been an open process?
Actually, we have open bargaining, and our members are free to come, and they have come out in droves. And we have had units come and tell their stories. Week after week, we have had departments come and say what it's like to work in the CCU, to say what it's like to work in the OR, to say what it's like to work in facility services and environmental services. We have had presentation after presentation during this open bargaining, and I think that's part of the message, is that we want to be heard. The people that work at Mercy Hospital want to be heard.
You said the vote was 96%. Do you know what the actual numbers were? It was 8.
I honestly don't, but it was hundreds and hundreds, unprecedented amount showed up today.
How many people could have voted? It's total. You know, ballpark figure is fine too.
2,000 plus, but not much. 2,100.
So about 50% did actually come out.
Oh, way more than 50%.
Did 96% vote, or 96% of the people that voted to strike?
96% voted to strike, but we had a well over 50%, exceeded well over 50% turnout.
If you had one message to send from tonight to the people that you're going to be bargaining with in the hospital, what would you all say to them?
We are united, we are committed, work together with us to get this done.